Hi, my name's Katie and I'm a speech pathologist.
What is a speech pathologist?
A speech pathologist is somebody who works with people across the lifespan to support them with communication skills and eating and drinking. My role with young children is to work with families to support children's communication development. So I might be working with you and your child on language skills, speech production, fluency or stuttering, and supporting their development with you.
What can I expect if I see a speech pathologist?
There would be a number of things that most speech pathologists would do at a first visit with a family or an adult. When you come for a first visit, I'm really interested in understanding why you're there, what you expect of the session, and that is about sharing information about what my role is and what your concerns might be. I will ask you lots of questions about your child's story. Information even as far back as the pregnancy and birth and your child's early history, because that's really helpful for me to understand the whole story about your little person, because there are lots and lots of different things that can impact on a child's communication development. I see you as the expert on your child, so I have expertise in communication skills and child development, but you are the expert on your child, and I always value information that parents can share with me about their child and about what's happening at home. In terms of assessment, which might start to happen at a first session with me, assessment can look like some different things, and it probably depends on the age of your child and why you've come along. Sometimes assessment looks like me playing with your child and interacting and taking lots of notes. So I might be sitting on the floor with your child if you have a really young child, and I'll be doing lots of observation and watching them play and watching them interact. I'm trying to understand your child and what their strengths are and what motivates them and what the challenges might be. And once I've got all that information, then I know how I might be able to best work with them and with you to support their development.
How do I access a speech pathologist?
Speech pathologists work in lots of different organisations. You can access information about different speech pathologists through places like your GP or your child health nurse. There's lots of information online with different speech pathology services, and of course word of mouth is really helpful. There are waiting lists at different times, so it's worth sort of asking around and finding out what other families have used, but certainly your GP or child health nurse is a good first point of contact.
Are there common misconceptions about speech pathologists?
I think speech pathology is probably fairly poorly understood in the general community. I think we probably have a reputation for working on speech sounds and stuttering, and certainly those are areas that we work on, but communication is much broader than that. So we work on language and voice and swallowing and speech.
How can I get the most out of my visit to a speech pathologist?
I guess you can think about what are the things that you're concerned about, what is the information that you have about why you've been referred, and you might have questions about that to ask a speech pathologist. You can think about what are the goals that you'd like to achieve in working with a speech pathologist, and also to think about who are the other people that work with you and support you as a family, and are they people that a speech pathologist could get in touch with to provide you a bit of a team.
A final word.
I love working with children and families, and what I love most about it is that we get to work together to support your child, and therapy can look really fun and it can be really exciting and motivating for children. So together we can help to support your child with their communication.